Have you ever wondered about the process healthcare professionals go through when prescribing medications? A multi-step procedure, it demands precision and knowledge. The initial step is an assessment, which is vital to understand the needs of the patient. It involves an intensive review of the patient's history, their present symptoms, and concerns. Crucial in this step is a detailed conversation and potentially a physical examination. So, the next time you receive a prescription, remember the meticulous process behind it. This involves a detailed conversation with the patient and potentially a physical examination. Upon completing the comprehensive evaluation, a diagnosis is thoughtfully formed. The careful interpretation of a patient's medical history, symptoms, and test results lead to this critical point. This diagnosis, a summation of meticulous effort and detailed analysis, acts as an essential beacon, illuminating the path forward. Once in place, it becomes the pivotal guide, directing the healthcare professional's next steps, shaping the therapeutic journey ahead. This path may vary from patient to patient, but the guiding principle remains constant: to provide the best possible care tailored to the individual's needs. Quite often, this inclusive treatment plan encompasses a carefully chosen selection of medication. After a diagnosis is made, there's a thorough treatment plan discussion with the patient that is initiated by the healthcare provider. This pivotal conversation is not just a mere chat, but an interactive, detailed exchange of vital information between the patient and the doctor. The doctor carefully outlines the prescribed treatment, particularly focusing on the medications that are to be taken by the patient. This discussion also extends to an in-depth explanation of the roles these drugs will play in the healing process. Each medication's potential side effects are clearly explained, along with the strategies to manage any possible discomfort. The doctor also provides a clear picture of the outcomes that can be expected from this process, is aimed at ensuring the patient is well informed about their health journey, and, importantly, that they are comfortable with the decisions being made. It's imperative that the patient thoroughly understands and wholeheartedly agrees with the treatment plan. Next, the healthcare professional must choose the right medication. This action isn't to be taken lightly. It involves meticulous analysis of various elements to ensure that the patient receives the most effective treatment. One of the crucial that guides this decision is the patient's comprehensive medical history. A thorough understanding of their past illnesses, surgeries, and treatments can shed light on their current health state and inform the most suitable medication. Concurrently, potential allergies must be taken into account. Any allergy can cause adverse reactions and hinder recovery. Equally important are possible drug interactions. Certain medications, when combined, may lead to harmful effects. Lastly, healthcare professionals must also evaluate the treatment's cost-effectiveness. Affordability is a crucial aspect of healthcare, and striking the right balance between cost and effectiveness can make a significant difference in treatment. It's a careful balance of many factors to ensure the best treatment for the patient. Once the medication is chosen, the prescription is written. This begins an intricate, painstaking process where each detail is of utmost importance, a process that demands the highest level of concentration and precision. The writing of the prescription is not just a routine, it's a sacred duty, a commitment to the health and well-being of the patient. The prescription is a detailed guide, a roadmap towards healing. Every single component, the medication name, the dosage, the frequency, the route of administration, plays a crucial role. It must outline the duration of the treatment, a carefully calculated timeline designed for optimal recovery. Lastly, it must clearly state any special instructions, unique directions that guide the patient's journey to health. Prescribing medications is a responsibility that demands precision and care. Every medical professional knows this. It's not just about writing a name on a piece of paper and handing it over. It's about understanding the patient's medical history, their current condition, their lifestyle, and so much more. It's a calculated process that combines the science of medicine with the art of caring for a human life. It's about considering every possible side effect, every possible interaction with other medications, and every possible outcome. The process requires extensive knowledge, constant learning, and unwavering attention to detail. It's a process built on trust from the patient that the professional will do everything in their power to ensure their well-being. It is designed to ensure safe and effective treatment for patients, with their safety always being the primary concern. To recap, the process of prescribing medications involves patient assessment, diagnosis, discussing treatment plans, choosing suitable medication, and writing the prescription. It's a multifaceted process which demands an in-depth understanding of the patient's needs and careful evaluation of many factors. This process calls for the expertise of medical professionals who are adequately trained and experienced in this field. It's critical to ensure that the right medication is prescribed to the right patient, taking into account their medical history, current health status, and possible drug interactions. This can make a significant difference in their treatment outcomes. Thank you for joining us today. We hope guide has been helpful. Until next time, take care and stay curious.